You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Dr. Leslie Carver, a leading researcher studying brain development and social cognition in both typically developing children and those with autism. Dr. Carver's work offers groundbreaking insights into how autistic children anticipate and process events, and how this can shape their social interactions. Dr. Carver will share how her research can help us better understand and support autistic children. Welcome to the podcast, Dr. Leslie Carver.
Thank you for having me, Jeffrey. It's really nice to be here.
It's my pleasure. And correct me if I'm wrong, is that you work and your research starts with children at a very young age. Is that accurate?
Yeah, that's true. Some of the research that I do starts with infants. So we are very interested in the developmental progression that we see in autism. And because autism can't really be diagnosed reliably until kids are about 2 or 3, one of the best ways we can tackle like the question of development has to do with testing infants who have a sibling who has autism. So if you have a sibling with autism, you have about a 20% chance of also ending up with a diagnosis of autism, and about another 20% chance of having some other challenges that go outside of autism. And that's much higher than in the general population, where it's between like 1 and 2%. So we can test questions about development in those children that might help us to understand sort of how development unfolds in a kid who has autism.
And when I think about diagnostics in general, even as a child progresses throughout their developmental life, is the diagnostics change. The questions that you're asking and looking for change and adapt. They become more complex over time, I feel like, as far as like you're trying to really get deeper and deeper. Yeah. What is it about that infancy, that toddler age that is different, that we can start to identify some barriers to development, or some barriers that might exist future in life, or just some uniqueness that occur before we can identify real social challenge?
Right. So I think this is a really interesting question, because when I first started studying siblings of children with autism, we really thought we were going to be able to identify sort of a red flag that would pop up really early in development, and we would know that children were going to have social challenges. And that hasn't really happened. So where people have found things that are good predictors of a child later being diagnosed with autism, they're not as much about social things. There's some really early work on where babies look and the trajectory that unfolds about where on a face you look. So babies start out looking at eyes a lot, and then there's a little dip in how much they look at eyes, and babies start looking at mouths, especially when they're learning language, because the mouth is a great source of information for words. And then neurotypical babies resume looking at eyes and really increase how much they look at eyes over the course of development. And the beginning part of that looks really similar in kids who eventually end up having autism. They start out looking at eyes, they sort of have this dip, but then they stay low and they don't resume looking at eyes as much. So that's a little bit of a social finding. But a lot of the rest of what we found is there's some motor control differences in really early in kids who end up developing autism. There's some attention shifting, and actually this like looking at eyes thing could be about attention shifting. It could be social, but it could be something other than social. So the social changes really seem to emerge over time, which is interesting because they're also the things that are the most salient if you see a child with autism, right? They have a hard time connecting. And the sort of theoretical perspective that I was raised in academically was really about the social challenges that kids have. And it kind of came from a perspective of what's wrong with this child that they can't connect socially? So what is it about their social brain? Is it different in some ways? Are they less motivated by social things? And several years ago, as I was sort of thinking about it, I was thinking that if you know people with autism, and I've known a lot of people who have autism, my family members who are on the spectrum, they actually want to have social relationships. So the motivational piece is there, but it's incredibly difficult to understand how to navigate the world that is sort of set up for neurotypical people socially. Somebody recently described it to me as like being left-handed. So the whole world is set up for a way of thinking and a way of acting that's different for you. So my research now has really focused more on this question of trying to understand what it is about the social world that makes it so challenging for people with autism and makes it so easy for neurotypical people. Like neurotypical people don't really have to think about a lot of the things that they do to navigate the social world. And people with autism really have to think it through anytime they're going to do anything or get a response from anybody. So most of the research I do is trying to tackle that question in different ways.
Yeah, but I mean, it does make sense, is that if from an early age, is that the being able to kind of seek that reciprocal attention, or being able to kind of engage and understand somebody's responsiveness in their face, if that isn't a driving force when you're young, and other things are competing to a higher degree, then that social skill isn't getting started early enough, and that social recognition of social cues hasn't started developing, so it's a little bit delayed. So it's like a learned skill later in life that almost starts existing. Is that kind of a way to think through it?
Yeah, I think that's a great way of thinking about it, because it's surprising how much the timing of when you achieve certain skills is really important. So for example, we've found some data that suggests that young children with autism solve problems sort of differently, and when they encounter problems where there's a probabilistic component, so everything's not perfectly like predictable, that presents a really big challenge for kids with autism in a way that it doesn't for kids who don't have autism, but they eventually get there. So it's possible that just delaying some of these sort of developmental achievements sets kids on a pathway that ends up being very different by the time they're an older child or an adult. So that's one of the reasons I'm a developmentalist. I like to look at questions developmentally, because you can really understand sort of the origins of some of the challenges that people are facing.
And it makes sense. I mean, it's like anything else in the world, where you can start to find the root cause. It gives you a little bit of a better understanding of, the trajectory of how somebody experienced life, to where their responsiveness or where their skill sets lie, or where their strengths and deficits, because we all have them, but they're built throughout life, and it's a developmental trajectory of how you're navigating it. One of the things that's interesting to me, and that you've done some work on, is predictive coding. And I'd love to kind of break that down into, I guess, terms where it's like, oh, okay, that clicks. But can you give us a little bit of a synopsis or description of descriptive coding so our audience can kind of follow along?
Yeah, so predictive coding is the idea that we learn about the world by making predictions about what we think might happen. And then when we actually encounter that situation, comparing the outcome to what we predicted and adjusting our sort of future predictions and future learning based on what that outcome is. So this is it's a relatively new idea in autism research. I would say probably about 15 years ago was when sort of some of the first papers started to come out. And it really came out of this idea that is much older in the area of perception, which is that we make predictions about things that we're going to perceive in the world. And somebody sort of took that and started thinking about how it might apply to autism. And we've done some studies, and some of the initial studies that were done have to do with prediction in the perceptual domain. So I think you probably know that children with autism and adults with autism often have perceptual experiences that are a little bit different from neurotypical folks. Like they can be sensitive to
Yep.
things, and also just unexpected things perceptually can be really challenging. So I have a former grad student who did some research that I think is really compelling about how we make predictions about sounds that we're going to hear based on visual things that we see. So it's sort of a little bit about combining the auditory and the visual, but it's also about making predictions. So if you throw a ball at a wall, you know that when it hits the wall, there's going to be a sound associated with it. And he did a study where he sort of measured brain activity in adults when they were having an experience that sort of looked like that. And sometimes the sound happened when you didn't expect it. And that leads to an error signal in your brain. So one of the things that I do is I use electrophysiology to measure brain responses to different kinds of stimuli. And there's a brain component that you see that is larger if something unexpected happens. And he has some brand new research that we haven't published yet, so I don't want to say too much about it, but the summary of it is that it looks like in autistic adults, that response to something surprising is larger. And that's really consistent with predictive coding, which sort of breaks down to challenges either with anticipating what's going to happen or responding to something unexpected that happens. And some people describe it as giving too much weight to error signals when they happen. So making them more important than they really are. And then adjusting your future predictions based on that. And then more recently, people have kind of taken this idea about predictive coding that sort of emerged from perception, and they've started to apply it to the social world. And that's some of what we're trying to do in my lab. So the non-social world is pretty predictable. So like, unless you're manipulating things in a research study, when you throw a ball at a wall, it's going to make a sound. But the social world is pretty unpredictable. So how somebody's going to respond to you just really depends on like factors that are completely outside of your control and that you can't perceive, and what kind of day they're having, and like what happened yesterday, and maybe if they slept well. And those are all things that are very unpredictable, and they make it really hard to make predictions about social things. And so the hypothesis about the social world is that people with autism like more predictability in their world in the first place. And then they encounter a world that is not set up that way. So you have to navigate the social world, you have to be able to deal with like very unpredictable situations. And it makes it challenging to know what somebody's going to do or how they're going to respond, because it's not ever the same way any more than once one time. Really. So I'm trying to find ways to test that hypothesis. So I've done some research looking at how your brain makes predictions about what you're about to see. And I've done this research that I just mentioned about how your brain responds to things that are unexpected. And I have some research that I've been trying to plan and find funding for, which is a challenge right now. But what I would love to do is, I have a colleague who's at Cornell University. One of the things he studies is how children learn from contingent responses. So contingent responses, basically you do something and then I respond to it, and you know that my response is connected to what you did. That's a very strong driver of learning in young children. And it really relates to predictive coding because it's about understanding the response that you get back from someone else. So I'd love to see if that looks different in autism, but we haven't had the chance to do that work yet.
Yeah, but that work is so important. When you were describing predictive coding, that I'm just kind of thinking through kind of people that I know and children that I've seen experience these same sorts of phenomenon where it's things didn't go exactly as planned. And when I think of and I don't like to stereotype, but when I think of kind of stereotyping kind of some of the characteristics of autism, I look at, the analytics. Things that are concrete, have an answer. A lot of young adults, a lot of children thrive with that because, hey, I know this. I know it's right. My anxiety's lower here. I can get to the right answer, and I know the feedback I'm going to receive. But that conceptual piece, the responding to anything that is even in the gray area at all, it becomes, you see that it's work.
Yeah.
It's not just a response. It's not an immediate reaction. It is a, hold on, let me get myself in a position where I can start to think through it and process it the way I need to again. When you're talking about, you know, the whole predictive coding process, there's got to be a lot to that can go into teaching. And you mentioned contingent reinforcement, but also the preparation or the understanding of how to support, whether that's giving more time, whether that's being able to kind of prepare somebody if you know that something is going to be challenging and letting them know in advance. You might not, things might not go as planned here, but let's work through it together. What are some of the things that you would emphasize as you've looked at as you've looked at the research and looked at the topic in general, that we should be empowering families to understand how best to be able to utilize some of the knowledge of predictive coding to empower a child?
Yeah, I mean, so I would say, first of all, that I think it's incredibly important to just listen to people and to listen to the experiences that people have. I think the more that we do that, the easier it is for somebody who has autism to learn how to do that work that you're describing. So I had a conversation relatively recently with somebody who is autistic, but who has really figured out how to navigate the social world, and they do it by being very thoughtful and concrete and like thinking through all the possibilities. And I suspect if they encounter something unpredictable, they probably have a strategy for that, but it's probably significantly harder to navigate than all these rules that they've basically memorized. So for a neurotypical person, it's almost instinctive. You don't have to think through a rule when you interact with somebody. But this person, and I suspect a lot of people, what they do is they just like create a bunch of rules and then they follow through with them. So I think one of the most important things we can do to be sort of understanding and help facilitate like navigating that social world and dealing with those predictive challenges is to kind of understand that that's what somebody is doing. So that's the sort of the first thing, is if you're interacting particularly with an adult with autism or even a child who has sort of fewer challenges, a lot of what they're doing is they're trying to structure their world in a way that's predictable and create rules from themselves that help navigate when it's not. But the other thing we can do that's pretty obvious is really try to make the social world as predictable as possible. And I always am a little careful when I talk about this, because the last thing I want to do is get into sort of refrigerator mom territory. Because it's not the case that parents of kids with autism are causing their child to have autism by being unpredictable. It's that they have a child who probably needs more predictability. And I think when there's a lot of parents that I've seen through who sort of instinctively gotten that, and then they structure the world in a way that really helps the child. And I think it makes a major difference to
Absolutely.
just have sort of a structured, predictable world as much as possible. And then things like you described, I'm not a therapist, I'm not a clinical psychologist, but just what you described in terms of like, just say in advance what the possibilities are, and these are the things that could happen. That I think also can really alleviate the anxiety that probably comes out of those heightened responses to something that was not predicted that happened.
Absolutely. And what I kind of default to is I start thinking through, well, what is it that a clinician can learn through this same process? And you talked about the contingent reinforcement piece where, you know, you start to be able to develop those predictive responses, those things that, you know, hey, you know what, this response in this situation is going to get reinforced. But I think that it's equally important to start to create some variability over time, and to be able to realize that, hey, you know what, that same stimuli can change. That same reinforcement might be slightly different. When you're talking about some of those social reinforcers versus more of those tangible reinforcers, How important is it to pair when you're learning and teaching a child to pair those tangible reinforcers with the recognition of that social, hey, you know what, this is going well socially at the same time. Somebody is happy with my responding.
Yeah, I mean, I think that's probably really important. As I said, I'm not a clinician, so I'm not really an expert in questions about like how you do that. But I think it's probably really important because I think that when you have reinforcers that are extrinsic, so those tangible things like, I mean, one of the things that I learned to do when I was at my previous position as a postdoc at the University of Washington is where I learned how to do EEG recordings with children who have autism. And the way that you do it is you just like throw the book out the window and say, this is going to be completely unvariable. I'm going to get you to do this by giving you whatever you want. So like we would get the parents to say, what is your kid like? And then we would give it to them. So if you let us touch your head, there was a child that his favorite thing was chewing on a straw. So you get to chew on your straw if you let us do this. And
Mm-hmm.
and he was this particular child, he wasn't verbal and he was able to do our task because we just let him every time he would get his reinforcer that he really loved. But you don't want to do that in the real world, right? Because if you're trying to teach a child sort of maybe a social skill, you can't let them chew on a straw every single time that they need to be
Yeah.
able to do that. We have to figure out how to help them figure out that this also can be reinforcing. And that's
Mm-hmm.
pretty hard, right? Because so this question of how reinforcing something that's social is really close to some of my research. I've done some research looking at this in particular. And when you have older kids who have autism, their brain doesn't respond to social reinforcers the way that a neurotypical child's brain does. But
Yep.
because I'm a developmentalist, I'm really interested in these questions about where that came from. I'm trying to ask that question in younger and younger kids because it's possible that social stimuli become aversive over time because they get associated with this really unpredictable situation that we put kids in a lot of the time.
Yep.
Um, so, providing, so part of it goes back to the prior question about providing a lot of consistency and kind
Mm-hmm.
of learning how to make social things more reinforcing because they become more consistent.
Yeah.
But I think also just like pairing them. So there's some methods where you can, pair the reinforcer that you really like with this other reinforcer that you either don't understand or you dislike for some reason. I think could probably be really helpful. But yeah,
Yeah.
and variability, like you said, also is really important because I did not care when those children left the EEG lab if they ever let somebody touch their head or put an electrode cap on their head again. Like my job was to get them through it in the moment. And then
Mm-hmm.
we don't care if it lasts and we don't care if it generalizes to other situations. We just tried to get them to do this one thing so we could measure their brain activity. But that's not how the real world works either. We really want kids to get those skills and be able to apply them in a lot of different situations.
Yeah.
Um, yeah. So, um,
But I think when you're advocating for your child in both situations, one is I'm advocating for long-term gain. The other one is I'm advocating for that moment. I need to get this done. I need this dentist visit to occur. I need this EEG to happen. You're going to take different tools out of your belt to be able to use them. And I think parents can take that predictive coding and use it almost like an immediate, and then also realize some of the gaps that need to be built over time so
yeah.
that somebody can be successful. And I might have misspoke there because I almost think of those social cues when I talk with somebody is that I'm looking to see, are they following along? If I'm saying something that should be frustrating, did I get that response that I was looking at? When I say something that somebody should share that happy experience with me, am I connecting with them? But those are those social cues. If you're trying to be assertive or you're trying to be able to understand the social situation, you have to pair with something. You have to know how to use all those tools. And I think those are developed over time. And I think
And
it goes with predictive coding.
yeah, and I really think it's something that can be taught. It becomes less instinctive than what you see in somebody who doesn't have autism, but you can teach somebody, like, here's what to expect in this situation, and here's what to see on somebody's face that'll tell you if you got it or not.
Mm-hmm.
And then here's what it means if you don't get it. And so it's a lot more steps, and it's a lot less instinctive, and it probably is going to take more time. But I think that if I were somebody who studied treatment, that might be a way that I would be trying to approach it. And I think it's an implication of my research, really, that it could be used for those purposes.
Yeah, and what you just said right there is the importance of being able to fund these resources for research projects, because it should be guiding how we try and be able to empower people throughout the knowledge that we learn. We should empower other people. If it is clinical, if it is understanding social relationships as parents, if it is any of this, is that the research guides all that. And I think predictive coding has so much value in helping us to understand not just the nuts and bolts, but how to be able to get beyond that to truly give somebody independence. And I think it starts there. Where is the future research going to be taking us? What is it that you're hoping to be able to kind of take the idea of predictive coding? You said going younger, but
Yeah.
Are there other thoughts you have?
I'd love to follow children over time. So it's hard to do this research, especially if you're doing brain development research, because you take somebody who probably has some sensory issues, and then you try to get them to put like a wet net of electrodes on their head and watch a boring display. That's really tough and challenging. So this would absolutely require funding, but following this out over time, mapping how children with autism do or do not learn from social contingency, I think, is incredibly important and really hasn't been done. I mean, there's little hints of it in a few places. Some folks have looked at statistical learning, which is really related. It's how we pick up on regularities in our environment and use those to learn words or to learn other sorts of patterns that we find. So I think that is all really connected. And what I haven't seen and what I would love to do is to put that all together in a piece that sort of looks at, is it really true that people with autism want more predictability in their environment? Like we think that it is, because that's what kids look like, right? Mm-hmm. When things become unpredictable, as you said earlier, it's really challenging and difficult for them. Is it true that they learn differently from contingent responses? Or maybe they don't. Maybe they learn in the same way, and it's just necessary to have a more predictable environment. I think those are like the questions that I see as really being open in at least the area of autism research that I do. The other thing that's really important is that we listen to people with autism, families of people with autism, people who teach and work with people with autism. I have a student right now who is trying to do a survey asking questions about, what kind of research do you value? What kind of questions do you want to see asked? So I think, getting input from people in those kinds of ways is incredibly important.
Absolutely. I mean, that the best source of information oftentimes is the person who's experienced it firsthand, and you have to be able to talk with everybody to get that information. And you mentioned that the research, or you had mentioned a piece of research that hasn't been published yet, but where can people go to start, learning about the basics of this sort of knowledge set, of understanding some of this predictive coding, or understanding why it's important for us to be able to invest in research, for us to be able to say, hey, you know what, I'm going to pay it forward because this is going to be so important later. Right. Are there some pieces?
Well, I mean, I think this is probably not a super helpful answer, but the best source of information is always going to be the published research that people have done. So there is a lot of research now published, theoretical research. There's some pieces that are sort of a little bit more digestible in the literature about predictive coding and autism. People can go to my lab's webpage, which I'm happy to give you. I think I may have given it to to Jeremy earlier,
Wonderful.
to see the research that we're currently working on.
Mhm.
And I had mentioned I'm not very good at social media, so I'm not one of those people who puts up every paper on Twitter and those kinds of things. But that's what I would do. I mean, I think especially right now, we're in an age, honestly, that people are really doubting science. And I think it's important to look at published research because it undergoes review by experts. And that is one of the best ways to know that what you're looking at is reliable and has gone through a rigorous scientific process. I think one of the things like that people sometimes do is they'll look at social media or they'll look at a podcast and or listen to a podcast and just take what they hear for granted. And I would really challenge people that it's important to trust experts, but also to look at the literature and the research yourself. Because one of the best ways that you can know what somebody's research means is to really look at what they actually did. Because sometimes we don't do the things we need to do. Like we don't always control things in the best way. And you know, maybe we are looking for an answer and we manipulate our stimuli to give us the answer that we're looking for. So you can't really tell that by listening to somebody describe their research. You have to look at it yourself. So if you have access, I think more and more publications are open access. I would say read those kinds of documents and papers to really understand what you're looking at.
Yeah, and you're spot on. I think that being able to make sure that something is empirical and validated is important, because there's so many rabbit holes you could go down. You only have so much time and resources. So making sure that what you're doing has some validity, has the research has been worked through and it's been thought out and that it's replicable and people know that this is something that works. It's important. But and on the note of reading research, it used to be really hard for everybody to digest. I mean, quite frankly, it's like all these things feel like it's like different languages based off of the science that you're reading and everything that you got terms, you got like it becomes so hard. This isn't a plug for AI, but some of these AI summaries it makes it more digestible for the overall population to say, hey, you know what, I mean, you can't rely on it completely, but it gives you a gist and it gives you a better understanding.
You need to double check what they're saying, but it's true. It's at least a good first start. One of the things I teach an honor seminar to students, and I get people from all kinds of scientific disciplines to come talk about their research. And my students have to read their papers, and it's often not in the area that they're majoring in. So one of the first things I teach them is to look at the pictures. So most publications have like diagrams of methods, pictures of their stimuli, graphs of their findings. And you can learn a lot about what people did and what people found in their research by reading those things. Because if you try to read a results section in an empirical paper, for example, it's a ton of statistics. It's basically a wall of numbers. And it's really hard to digest what those numbers mean. But if they're sitting next to a graph that says, you know, like condition 1, condition 2. So when you do this and when you do this, and one is higher than the other, that is much more easy to digest. So
absolutely,
it's another good strategy in addition to AI.
No, for sure. I mean, it makes it less intimidating. So I think that's the most important part is that you feel like I can do this. But Dr. Carver, thank you. Oh, go ahead.
I was going to say that when we were young, reading the pictures, looking at picture books was considered less sophisticated, but I think it's actually a way to get a lot of information.
I couldn't agree more. But I appreciate you coming on today, Dr. Carver. And once again, I feel like I walk away with so much more information and so many more thoughts going through my head just by having the discussions. But thank you for your time. I think that this is such valid and such important information to start for me to start digesting.
Well, thank you so much for having me. It's been really fun talking.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.